person. Do you realize that there's a story behind the statistics? Homelessness is not just a local issue, but it is also a global issue. And this PSA is going to give you a glimpse into these issues.
I'm Elizabeth Anderson. I'm Ashley Birthstone.
I'm Brian Lewis.
Tonight we're down here at 210 Rio Grande interviewing some of the homeless people in Salt Lake City.
We're trying to figure out what issues they face, including health insurance, health care, and environmental factors and health literacy barriers.
We're also trying to figure out their stories and how they became homeless. Homelessness in Ghana is rising at an alarming rate, with 70% of the homeless people under the age of 20. India is estimated to be the home of 78 million homeless people, including 11 million street children. In 2013, 112,000 people declared themselves homeless in England. This is a 26% increase in the last 4 years. The National Alliance to End Homelessness estimates that there are 633,782 people experiencing homelessness on any given night in the United States, with 142,000 of them being children, 62,000 being veterans, and an estimate of 269,000 who are disabled and unable to work. Domestic violence is the leading cause of homelessness among women. According to the National Law Center of Homelessness and Poverty, more than 90% of homeless women are victims of severe physical and sexual abuse, and escaping that abuse is a leading cause of their homelessness. 94.1% of people living on the street have behavioral health challenges. 12.1% are mental health, 12% are substance abuse, and 70% have the dual diagnosis of both.
In 2014, it is estimated that over 13,000 persons experienced homelessness in Utah. Many homeless individuals are victims of circumstance, illness, and trauma from violence or abuse. Roughly 29% of all homeless children are children. About 38% of all homeless persons experience mental illness or substance abuse. And 35% report domestic violence, which has become the leading cause in homelessness in women. A significant portion of the homeless in Utah are actually part of a family as well. Persons in family constitute 46% of the total population. 40% are single men and 14% are single women. 88% of Utah's homelessness population lived in Utah when they became homeless as well. Ready to go?
Alright, do you mind telling us your name?
Yeah, it's Josh Chatterton.
Josh, nice to meet you. I'm Ashley.
Boy.
What do you think the biggest health issues you face are?
Mine is, I'm just going to speak for our rights.
We're trying to find ways to help. Yeah.
We get harassed by the police and stuff.
We're trying to find ways to help with health care for homeless people.
Oh, healthcare.
Yeah, so.
Changing policy and all that.
Everybody had healthcare.
Do you have health care?
And now there's Trump. Well, I went to 4th Street. I actually got chronic fatigue, so I went to 4th Street to get my medication. They said they don't give out narcotic medication. And so they say go to the block. So I go to the block.
Cool. Great.
But you can get in trouble too. So, but they say narcotic medication kills more people, so you figure you live longer, but you might do time.
Alright. Do you mind telling us your story? About you, a little about you?
Yeah. Basically, I grew up in West Valley, and was raised very strict LDS, and basically went on a mission and got married and had a job. I was making a lot of money as a lead technician for DirecTV, and had a family, some kids and stuff. What happened is I got injured and I broke my leg and I got addicted. I went to get it looked at. They prescribed medication for it, and I got addicted to that medication, which led to me getting addicted to black or heroin. So I couldn't function without it. I had to have it every morning. I spent about $300 a day. So at this time I was a lead technician plus I owned my own dealership, so I was making a lot of money. But with $300 a day, I was still maintaining still able to do everything. What happened was the system got me, and it was once they put me in jail, it was like I lost everything.
Very sorry to hear that. As you can see from the interviews you've just watched, homelessness can happen for a number of reasons, and one of the biggest problems homeless people face is access to health care.
Healthcare access is a significant issue for the homeless population. One of these barriers includes the Medicaid program, which actually only covers non-disabled adults, but disability runs rampant within the homeless population. There are also other barriers in the homeless population getting care, including literacy, education, and transportation. The Forestry Clinic helps with some of these areas by providing care to individuals who do not have insurance, but there are still barriers that are